If you are over the age of 55, there is a specific lower body exercise you are probably doing right now to stay fit that is actually shaving years off the life of your hip cartilage. Take Robert, for example. At 58 years old, he was an active grandfather who loved his morning walks. He had just started some new gym resolutions to keep himself feeling young and healthy. But one Tuesday morning, he woke up with a knee so swollen and painful that he could not even climb out of his truck. At first, he just assumed he overdid it at the gym. But here is the hidden twist. The real problem was not his age. It was not arthritis, and it was not even a lack of calcium. It was a single, highly recommended fitness routine he was doing 3 times a week. I'm Dr. Kumdi, and after 20 years of treating thousands of aging joints, I've seen this exact mistake destroy active retirements. Today, I'm revealing the 4 common exercises you must stop doing immediately if you want to avoid a painful joint replacement. Make sure you stick around for number 1, because it is a staple in almost every senior fitness class, and it completely blindsides people. Before we dive into the list, drop your age and where you are watching from in the comments below. I read every single one to see who is taking control of their longevity. Now, let's look at the first hidden danger. The first dangerous exercise on our list is the 45-degree seated leg press machine. If you walk into almost any gym, you will see people using it, and it seems completely harmless. In fact, many people think it is much safer than a regular squat because your back is pressed flat against a comfortable, padded seat. It feels like you are getting all the benefits of leg day without risking your posture. But beneath the surface, there is a hidden biological danger. When you sit in that machine and bring your knees close to your chest, it actually forces your lower spine to bend in a harmful way. At the exact same time, a massive amount of pressure squeezes down on your back. Even worse, the machine locks your legs into a rigid, unnatural path, which overloads the delicate joint right under your kneecap. This is exactly why older adults are so vulnerable to this machine. After age 55, the tiny discs between your spinal bones naturally lose their fluid. They become thin and brittle, like a dry sponge. At the same time, the cartilage in your knees starts to wear thin. A well-known study on joint mechanics actually proved that these fixed-axis leg presses increase a damaging, scraping force on your knees by over 30% compared to a natural bodyweight squat. Think about the emotional cost of this mistake. You are using this machine because you want to build strong legs so you can easily run around and play with your grandkids. But in reality, you are secretly grinding down the vital, fluid-filled cushions that allow you to walk without pain. By trying to stay strong, you might accidentally be racing toward a surgeon's table. And the next exercise on our list is one that people do every day to fix their posture, completely unaware of the damage it leaves behind. That brings us to the third dangerous exercise on our list, which is pushing weights or resistance bands up from right behind your head. People usually call this the behind-the-neck shoulder press, and they often do it to build upper body strength or fix their posture. The real danger with this movement is how quietly it damages your body. In the beginning, the symptoms are incredibly subtle. You might just notice a slight clicking sound in your shoulder when you reach back to grab your seatbelt, or perhaps a mild ache when you try to sleep on your side at night. Most people dismiss these early warning signs immediately. They tell themselves that it is just a normal part of getting older, or that it is just a little morning stiffness that will eventually go away on its own. Even gym trainers and regular doctors often overlook the issue. Standard fitness trainers are usually looking for raw strength gains, like how much weight you can lift, rather than checking for the microscopic fraying happening inside your rotator cuff. The scary truth is how this damage accumulates over time. Your joint cartilage actually has no nerves in it. Because it cannot feel anything, you will not feel any warning signs while it is wearing away. By the time you finally feel sharp, agonizing pain, the protective cartilage is already completely gone, leaving you with a painful bone-on-bone situation. I saw this happen with a 62-year-old patient of mine named Sarah. She loved doing behind-the-neck presses to keep her upper body toned. For months, she ignored a dull, quiet ache in her shoulder, assuming her muscles were just working hard. Then, one ordinary afternoon, her shoulder muscle completely tore while she was simply lifting a light grocery bag out of her car. What felt like a simple fitness routine was actually setting a trap for her joints. But why do our bodies suddenly start failing us during these common exercises? To understand that, We have to look at how our internal mechanics change as we age, which brings us to a shocking truth about how your body actually works. To really understand why this happens, we need to look at how the human joint works as a mechanical system. Think of your joints like the suspension system and the shock absorbers on a classic car. When you are 25 years old, those shocks are brand new. They are filled with thick, fresh oil, and they have pristine rubber parts. Every single bump you hit on the road gets completely absorbed, and the car rides smoothly without any damage to the frame. But as time goes on, a dangerous chain reaction takes place inside your body. After you pass the age of 55, that internal oil, which doctors call synovial fluid, naturally starts to dry up. At the same time, those protective rubber parts, which are actually your joint cartilage, begin to thin out. This is exactly why aging completely changes the equation when you exercise. Imagine taking that beautiful classic car and forcing it through a brutal, bumpy off-road mud race with those worn-out shocks. Because the cushions are gone, the heavy metal frame is eventually going to crack from the impact. That exact same metal-on-metal grinding is what happens inside your knees and shoulders when you do the wrong movements. It triggers a deep, constant swelling that eventually forces you onto an operating table for a full joint replacement. Now that you know how these shocks were down, you need to know about the next exercise, which actually accelerates this grinding process faster than almost anything else. This brings us to the second dangerous exercise on our list, which is stepping forward into deep, weighted lunges where your knee pushes far past your toes. People love this move because they think they are building strong thigh muscles to protect their legs. But when you hold heavy weights and drop your back knee close to the floor, you are putting a massive amount of stress on the front joint. The numbers behind this mistake are truly alarming. Medical data from joint doctors reveals that over 40% of joint replacement patients over the age of 60 were actively doing high-impact or deep-bending knee exercises right up until their joints completely failed. If you keep doing these deep lunges, the worst-case outcome is terrifying. You risk a complete loss of your independent mobility. You could face constant, throbbing nighttime pain that keeps you awake for hours, and eventually, a mandatory 6-month painful recovery from a total knee replacement surgery. The most deceptive part of this exercise is the difference between a healthy feeling and the hidden damage. While you are doing the lunge, your thigh muscles might feel great, and you might think that good muscle burn means you are getting stronger. But underneath the skin, your kneecap is actually acting like a cheese grater, scraping away at the soft cartilage underneath it. You are not just risking a sore muscle here. You are risking your basic ability to walk down the stairs to your own basement. Yet, as bad as deep lunges are, the absolute #1 fitness mistake on our list is something people do every single day in their own living rooms, believing it will cure their back pain. That brings us to the absolute #1 fitness mistake on our list, which is the traditional floor sit-up or stomach crunch. Almost everyone over the age of 55 does this exercise because they want to strengthen their core and protect their lower back from injury. It seems like the most logical thing to do. But this common belief is completely wrong, and it is actually creating a disaster for your spine. When you lie on the floor, pull your neck forward, and bend your back over and over again, you are putting dangerous pressure on your spine. Think of your spinal discs like a small tube of toothpaste. When you squeeze a tube of toothpaste tightly from the very front, the paste inside gets forced violently out the back. That is exactly what happens to your spinal discs during a sit-up, as the soft inside gets pushed out toward your sensitive nerves. This leads to a terrible compounding effect. As people keep doing sit-ups, they notice that their lower back is starting to hurt. Because they assume their back hurts from having a weak stomach, they actually do even more sit-ups to try and fix it. This mistake accelerates a painful herniated disc. It traps you in an overlooked, dangerous cycle. You do the exercise, which causes deep inflammation in your back. Because of the pain, you are forced to rest on the couch for days. While you are resting, your body suffers from muscle loss, which then creates even more joint strain the next time you try to move. The good news is that there is a very simple, practical correction. You can instantly swap out traditional sit-ups for an exercise called the bird dog, or you can try a modified forearm plank. Both of these movements build a rock-solid core and protect your back without forcing a single spinal joint to bend or grind. Now that you know which exercises to stop doing today, Let's look at the exact daily protocol you should start doing instead to repair your joints and keep them moving freely. To help you protect your body, I want to share a simple 3-step daily checklist that I call the Joint Saver Protocol. This routine is designed to keep your body moving smoothly without causing any of the hidden damage we just talked about. The very first step is called the zero gravity rule. This means you need to replace high-impact exercises that squeeze your joints with fluid, natural movements. For example, instead of using that heavy leg press machine that crushes your knees and back, you can switch to doing simple wall slides. All you do is place a soft yoga ball between your back and the wall and gently slide up and down. This keeps your feet planted safely while your body moves naturally, completely removing the dangerous crushing force. The second step is called the 90-degree boundary. This is a very straightforward rule to remember whenever you are lifting any kind of weight. You must never bend your knees or your shoulders past a sharp right angle when they are under a heavy load. When you stop your movements at 90 degrees, you protect your delicate cartilage from getting pinched or scraped, while still allowing your muscles to get a fantastic workout. The final step is the decompression routine. All you have to do is spend just 2 minutes a day doing a passive hang from a sturdy bar or practicing a gentle stretching routine that pulls your joints apart slightly. Think of this like opening up a squeezed sponge. It creates space inside your joints, allowing fresh, healthy fluid to rush right back into the spaces between your bones. This entire protocol works beautifully because it naturally stimulates your body to produce more lubricating fluid. It oils your internal gears without rubbing or grinding your thin cartilage. The best part about this routine is that it costs absolutely nothing. It takes less than 5 minutes of your day, and nobody in commercial gyms ever talks about it because they would rather see you buying expensive machine memberships. Now that you have this powerful tool in your hands, let us look at how these simple changes can completely transform your health, just like they did for Robert. Remember Robert, the grandfather we talked about at the very beginning? Luckily, we caught the damage in his knee just in time. We completely stopped his heavy leg presses and swapped them out for safe bodyweight box squats and gentle glute bridges. Today, at 58 years old, he is happily back to walking 3 miles a day with his grandkids, and he is completely surgery-free. His story shows us the most important lesson of all. Small, repetitive movements that feel completely fine when you are 30 years old become incredibly dangerous after you turn 55. This happens simply because the biological shock absorbers inside your body have changed over time. Your amazing body has carried you beautifully this far through life. The true goal of this video is not to make you afraid of exercise or movement. Instead, it is to give you the helpful awareness you need to protect your physical freedom for the next 30 years. So, let us start making changes right away. Tomorrow morning, when you wake up, do not jump straight into a deep stretch or a painful floor crunch. Instead, start your day with the simple, safe wall slides we discussed earlier. If you found this medical advice helpful, please share this video with a close friend or a workout partner over 55 who needs to hear this vital warning. Hit that subscribe button right now, and let us work together to keep your joints feeling young. Thank you for watching, and I will see you in the next video.